Hello, I'm Armin Budish. Welcome to Golden Opportunities.
Today, here's to your health. We'll prescribe medical news you can use. Then, we'll help you map out the twisty road of your life's financial journey with a personal GPS, a guiding plan for solvency. Plus, medications can be miracles, but prescriptions can also become addictions. We'll detail the dangers of drug abuse for seniors. And will you lose your home if you need a nursing home?
It's time to get GOing, so pull up a chair and join us at our kitchen table for Golden Opportunities. Does your back pain keep coming back? Does your sore spine stop you from going about your daily life? Dr. Kermit Fox is here with tips on what to do to try to put your back at ease. Dr. Fox is a physiatrist with Metro Health. Thanks for joining us, Doctor.
Well, thanks, Armin. Good job on the pronunciation, by the way.
Well, I have to ask you, what is a physiatrist?
Well, a physiatrist is a doctor who focuses on maintaining and restoring function. We're all about getting your quality of life and not just trying to look at a specific problem and fix it, but looking at the big picture.
And you're talking about the back specifically.
I'm talking about the back, but it can apply to any joint in the body because everything's connected.
Okay. So, our viewers tend to be older. As people age, are we stuck with back pain? Is that something we'll all get?
Well, unfortunately, it's a very common problem. There is a natural wear and tear process to the spine as we age, but there are other things that can contribute as well. Inactivity, being overweight. Some people are just more prone, even genetically, to it. So it is quite a common problem.
And more people go to the doctors for back pain than for just about anything else.
Second only to the common cold.
How does a physiatrist deal with back pain?
Well, first, we focus on trying to shift the patient's focus from just thinking about their pain to looking at their function. We want to look at their quality of life. So we step back, we examine the whole patient, not just their spine. We look at their knees, their hips, even their feet. We see how everything's linked together. And then we usually try to approach through physical therapy, occupational therapy, working on getting movement again, restoring normal movement.
Tell me what's involved typically with a treatment of a back pain?
Yeah, so we usually have them come into our clinic. We do an evaluation over 30 to 40 minutes. We come up with a treatment plan. If physical therapy was involved, we'd send them to a course of therapy. Occasionally, we might prescribe medications or do injections. And we'd also look at their lifestyle to see if they can make any changes, eating habits, exercise, other things like that nature to try to decrease the strain on their back.
You mentioned medications. When is that appropriate? What kind of medications are we talking about?
We do try to minimize medications. There is an epidemic of over-prescribing medications going on, especially in the elderly, but sometimes medicines are appropriate to help decrease pain, but we usually focus on just using medicines to create a window in time where people are feeling a little bit less pain so they can focus on doing their exercises and their therapy.
So the purpose of the medication is not as a cure necessarily, but it's to make someone feel good, well enough to actually do the things you talked about. The therapies, the exercise, things like that.
Yeah, it's just one tool in our arsenal. We just try to help people feel better because once people are doing the things they enjoy doing, the things they weren't able to do, we find that their pain goes away quite often, if not all the way, quite a bit just on its own.
Is the goal of a physiatrist to get rid of all the pain or make it manageable?
I'd say more to make it manageable. Our main goal is to get people back to doing the things they love to do. And when people shift their focus from their pain to their function, they tend to do much better.
How successful are you dealing with back pain through the medications leading to the therapy as opposed to surgery?
Okay, good question. Surgery works great in the right patient population, but most people don't actually need back surgery. Most people, before surgery is even a consideration, need to do these conservative things we're talking about. And we're pretty successful if someone's committed to doing what they need to do to make their lifestyle changes, do their exercises, lose weight. Most people tend to do pretty well.
Can you, and I know this is a bad question to ask a doctor, but is there a percentage of people that you can say would improve enough that they don't need surgery when they come in?
I'll give a ballpark figure, but I'd say probably 95% of the people that walk in our door will never need surgery on their back ever.
Wow, that's great. Well, this is great information, Doctor. Thank you very much.
You're welcome.
It's great to meet a physiatrist. Back pain can be debilitating, but by focusing on your form and your function, Dr. Fox and his colleagues at Metro Health can help you put your back pain on the back burner, no matter where you live. And you can see them in Westlake and Strongsville and at Metro Health's main campus. And then, coming in July, there's also a new center in Middleburg Heights, which is very exciting. So to find out more, call the Metro Health Spine Center at 216-778-3700 or log on to metrohealth.org/spine. My thanks to Dr. Fox, a physiatrist, for joining us today.
Call Metro Health at 216-778-7800 to learn more or visit www.metrohealth.org. Want more Metro Health medical information? Be sure to tune into WTAM 1100 Radio each Saturday morning at 7 for Metro Health and You, hosted by Dr. Christine Alexander. Next, choosing the best financial road for every stage of life.